My name is Hind. I'm a postdoc at KU Leuven, Belgium. I work at Target, the Translational Research Center in Gastrointestinal Disorders in the Department of Chronic Diseases, Metabolism and Aging of KU Leuven. I'm part of the lab of intestinal neuroimmune interactions, supervised by Professor Guy Boekstaans. I'm a mucosal immunologist by training, and in my work, I study the immunology of the gut. In our lab, we study irritable bowel syndrome. Irritable bowel syndrome, or IBS, is a disease of the gut-brain axis, formerly also called a functional gastrointestinal disorder. It's quite a prevalent disease. It affects, on average, 5% of the population, so you probably know a few people who have IBS. The most obvious symptom is altered bowel habits. IBS patients often suffer from constipation or diarrhea, or can even have both in the case of a mixed subtype. These symptoms can be improved by taking drugs which target bowel movements, like laxatives for constipation or loperamide for diarrhea. However, a vast majority of IBS patients also develop abdominal pain. Like other IBS symptoms, pain often occurs after food ingestion or is triggered by stress. But there are currently no effective treatment options for abdominal pain in IBS, and that's because we have an incomplete understanding of the mechanisms that lead to abdominal pain in IBS. This is why our lab is investigating the mechanisms of abdominal pain in IBS. We know some things about how pain develops in IBS. First of all, you need to know that the nervous system is also in your gut. It's called the enteric nervous system. It controls the movement of food through your intestine, your blood flow, your digestion, but it also controls your sensations. In IBS patients, the nerve endings that can feel pain in the gut are hypersensitive. They feel pain where they should not, but they also feel more intense pain than a normal person. There are many factors that influence IBS development. I focus on the role of the immune response in the development of pain in IBS. Often, before IBS patients get diagnosed, they go through many medical and other gastrointestinal exams, and they often get a colonoscopy to see what their colon looks like and if there is any inflammation. The colon of a healthy patient will look like this. In the case of patients with Crohn's disease or ulcerative colitis, the colon would look visibly inflamed. As you can see, this is quite obvious. For patients with IBS, despite all their gastrointestinal symptoms, the colon looks healthy. However, that doesn't mean that their immune system is not activated. 2 years ago, my lab found that after a gastrointestinal infection, mice develop a localized allergic reaction to food in the gut. After the infection has resolved, those mice start to feel pain just after eating the food they ate during the infection. We saw a similar phenomenon in patients. We injected food antigens into the wall of the colon of healthy individuals and IBS patients, and we filmed their reaction. This is a healthy individual after receiving an injection of milk. The white dot is a mark made next to the site of injection. The mucosa looks normal. This is an IBS patient receiving an injection of milk. Here, there is a local reaction. The mucosa is swollen, and you can no longer see the blood vessels at the site of injection. These observations gave rise to the idea of giving an anti-allergic drug called Ebastine to IBS patients and to see if their symptoms improved. Ebastine improves symptoms, including pain, in about 50% of patients. That's great news! At least for those patients. There's still a lot that we don't know. I started my project to understand how the immune system affects the development of pain in all IBS patients. For this, we took rectal biopsies from healthy individuals and from IBS patients of various subtypes, with constipation, with diarrhea, or with a mixed pattern. We dissociated those biopsies into single cells, and we isolated only the immune cells. Then, using a technique called single-cell transcriptomics, we can identify all the different types of immune cells present in the biopsies, what they're doing, how they're communicating with each other, and we can look for differences between healthy individuals and IBS patients. We're starting to analyze our data, so I don't know the rest of the story yet, but I hope that with my data, I will find ways to help patients with IBS manage their pain. And if you want to know more about my lab's research, you can scan the QR code on the left to get access to our research article, or the QR code on the right to read an article of the New York Times that explains our research in more detail. Thanks for taking the time to listen to me. I hope that you learned something.